If you're managing diabetes, beware of a common but dangerous dietary pitfall, fructose. Often perceived as a natural and healthy sugar because it's derived from fruits, fructose is anything but benign for those with diabetes. Its unique metabolic pathway and effects can severely disrupt blood sugar control and contribute to broader health issues. Let's delve into why steering clear of fructose is crucial for keeping your diabetes under control. Number 1. Insulin resistance. Insulin resistance is a significant concern for those managing diabetes, and fructose consumption can exacerbate this condition. Unlike other sugars, fructose is metabolized primarily in the liver, where it does not stimulate insulin production. This lack of insulin response can lead the body's cells to become less responsive to insulin over time. When cells fail to respond adequately to insulin, glucose remains in the bloodstream rather than being absorbed by cells for energy, leading to higher blood sugar levels. This mechanism shows how fructose directly influences the development of insulin resistance without adequately prompting the body's insulin-mediated regulatory processes. Therefore, reducing fructose intake is essential for preventing and managing insulin resistance, thereby aiding in better overall diabetes control. Number 2. Increased blood glucose levels. As we continue, please subscribe to this channel if you're finding this video helpful. Thank you. Fructose, when consumed in large amounts, can lead to significant blood sugar spikes, presenting a serious challenge for individuals with diabetes. Unlike glucose, which is directly absorbed into the bloodstream and can be utilized by all body cells, fructose is primarily metabolized in the liver. Here, it is converted into glucose, fats, and lactate, which can indirectly contribute to elevated blood glucose levels. Moreover, because fructose does not stimulate insulin secretion as glucose does, the body's natural response to regulate blood sugar levels is not activated effectively. This absence of an insulin response can make it difficult for diabetics to manage their blood sugar levels after consuming fructose. Foods particularly high in fructose include soft drinks, sweetened beverages, and processed snacks that use high fructose corn syrup as a sweetener. Thus, avoiding these high fructose foods is critical for maintaining stable blood sugar and preventing the dangerous peaks that can occur with its consumption. Number 3. Obesity. Obesity is a major risk factor for developing type 2 diabetes, and fructose intake is closely linked to increased obesity rates. Fructose, especially in the form of high fructose corn syrup found in many processed foods and sugary drinks, contributes to weight gain by interfering with the body's normal hunger signals. Unlike glucose, fructose does not stimulate insulin secretion or the release of leptin, a hormone that helps regulate hunger and body weight. Without these signals, the body doesn't receive the normal cues that it's full, leading to overeating. Additionally, fructose is metabolized in the liver, where it can be converted into fat more readily than other sugars. This can lead to an increase in visceral fat accumulation, a type of fat stored around vital organs and associated with numerous health problems, including diabetes. Reducing fructose consumption can therefore be a crucial step in managing weight and preventing obesity-related complications in diabetes. Number 4. Increased risk of fatty liver. Fructose consumption is directly linked to an increased risk of developing non-alcoholic fatty liver disease, NAFLD, a condition that is particularly concerning for individuals with diabetes. Unlike glucose, fructose is primarily metabolized in the liver. When consumed in large amounts, the liver metabolizes fructose into fat. Over time, this can lead to an accumulation of fat in liver cells. This excessive fat accumulation impairs liver function and can progress to NAFLD, which may further evolve into more severe liver conditions like cirrhosis or liver fibrosis. For individuals with diabetes, the presence of fatty liver is especially dangerous as it can exacerbate insulin resistance and make diabetes management more challenging. Reducing fructose intake, particularly from sources like sugary drinks and processed foods, is critical in preventing fatty liver and maintaining overall health in diabetes management. Number 5. Worsening of lipid profile. Fructose consumption can significantly worsen the lipid profile, an effect that is especially detrimental for individuals with diabetes. When fructose is metabolized in the liver, it not only converts to glucose but also to triglycerides, a type of fat found in the blood. High levels of triglycerides contribute to the deterioration of the lipid profile by increasing the levels of bad LDL cholesterol and lowering the good HDL cholesterol. This shift in cholesterol levels can lead to the development of atherosclerosis, where arteries become clogged and hardened, increasing the risk of heart disease and stroke. Since people with diabetes are already at higher risk for cardiovascular issues, managing fructose intake is crucial. Minimizing fructose can help maintain a healthier lipid profile, thereby reducing the risk of heart complications associated with diabetes. Number 6. Interference with brain signaling. Fructose has a unique impact on the brain that can complicate diabetes management. Unlike glucose, which helps regulate appetite by influencing brain signals, fructose consumption does not effectively stimulate insulin secretion, nor does it significantly impact leptin production, a hormone that signals satiety to the brain. This lack of hormonal feedback can disrupt the normal appetite-regulating processes in the brain, leading to increased food intake and difficulties in managing hunger. Additionally, research suggests that high levels of fructose consumption may impair insulin signaling in the brain. Insulin in the brain helps regulate energy balance and body weight. When this signaling is disrupted, it can contribute to an increased risk of obesity and worsening of metabolic syndrome components, such as high blood pressure and glucose levels, all of which are critical factors in diabetes management. Reducing fructose intake can help maintain better brain signaling, supporting more effective diabetes control. Number 7. Increased uric acid levels. Fructose consumption is directly linked to increased levels of uric acid in the body, presenting a particular health concern for individuals with diabetes. When fructose is metabolized in the liver, one of the byproducts is uric acid. Elevated uric acid levels can lead to the development of gout, a form of arthritis characterized by painful inflammation in the joints. Additionally, high uric acid can cause kidney stones and may worsen kidney function, complicating diabetes management further. For people with diabetes, maintaining optimal kidney function is crucial since diabetes itself can lead to kidney damage over time. By reducing fructose intake, individuals can help control their uric acid levels, thereby preventing the additional health issues that elevated uric acid can cause. This is especially important in managing the overall health and complications associated with diabetes. Number 8. Enhanced appetite. Fructose can significantly enhance appetite, posing a challenge for individuals with diabetes in managing their caloric intake and weight. This effect is primarily due to fructose's minimal impact on insulin and leptin, hormones that play key roles in hunger regulation and satiety signals. Unlike glucose, which triggers a substantial insulin response that helps to signal fullness to the brain, fructose does not prompt these necessary hormonal responses effectively. As a result, consumption of fructose-rich foods does not lead to the same feelings of fullness as foods high in glucose, which can result in increased calorie consumption. This unchecked appetite can lead to weight gain, complicating diabetes management and increasing the risk of developing additional health issues such as insulin resistance and cardiovascular disease. Reducing fructose intake can help mitigate these effects, aiding in better overall diabetes control and weight management. Number 9. Risk of diabetes-related complications. Fructose consumption significantly heightens the risk of various diabetes-related complications. Due to its unique metabolic effects, fructose can exacerbate several underlying conditions that are commonly associated with diabetes. For instance, fructose's role in increasing blood sugar levels and contributing to insulin resistance can accelerate the development of chronic diabetes complications such as neuropathy, nerve damage, nephropathy, kidney disease, and retinopathy, eye disease. Furthermore, fructose's impact on lipid profiles, increasing triglycerides and decreasing HDL cholesterol, can amplify the risk of cardiovascular diseases, a major cause of morbidity and mortality in diabetic patients. Its association with obesity and fatty liver also adds to the burden, potentially leading to liver dysfunction and additional metabolic disturbances. Managing fructose intake is therefore crucial not just for blood sugar control, but also for reducing the overall risk of these life-threatening complications. Reducing fructose intake is crucial for managing diabetes effectively. By understanding and avoiding this sweet danger, you can better control your blood sugar, protect your liver, and prevent serious health complications. Make informed choices to safeguard your health and enhance your quality of life. You might also want to watch this video on the best foods for diabetes. And please subscribe to this channel if you found this video helpful. Thank you for watching.